Most couples that are struggling to get pregnant have already done lots of blood work, and yet they still don't have the answers. Hi, my name's Ina, a naturopathic doctor focused on fertility and a proud mama for after 30. I've helped so many couples through this phase, and this is what I can tell you. What you test and when changes everything. Most fertility testing only checks if something is absolutely catastrophically wrong. They don't test if your body is ready or optimized for pregnancy. These are the tests that I'd run for you and your partner, why each one matters, and what they actually tell us without drowning you in numbers. Let's start with you, and then we'll move on to him. Because yes, this is a 50-50 equation. Number 1, cycle-timed hormone testing. Hormones don't work on their own. They work together in sequence. So testing them on the wrong day or at the wrong time will either give you false reassurance or false panic. We're looking at the signal from your brain to your ovaries, how your ovaries respond, and whether ovulation was supported after it happened. This tells us if your cycle is coordinated, not just normal. Think of this as running a relay race. If one of the runners comes in early, late, or drops the baton, the whole race fails, even if the players look healthy. Tests that should be included are your LH, FSH, estradiol or E2, and progesterone in the second part of your cycle after ovulation. And all of these must be done at specific points in your cycle to be meaningful. Number 2, ovulation confirmation, not prediction. Most people assume that ovulation happens because their cycles are regular, because the LH strips turn positive, or because an abs says so. But confirmation tells us if ovulation actually completed and then transitioned into the second half of your cycle, also known as the luteal phase. This is where implantation lives. Think of getting a positive LH surge as you revving the engine. Ovulation confirmation lets us know if the car actually moved. Tests that are important to look at are your mid-luteal progesterone levels, as well as basal body temperature tracking. But this is something that needs to be tracked throughout your cycle, and we're not looking at a single day spike. Remember that LH strips alone never confirm ovulation. Number 3, thyroid function. And here you want the full picture because the thyroid controls ovulation signaling, egg maturation, implantation environment, and miscarriage risks. And even a subtle dysfunction can block pregnancy even though your periods remain normal. So think of your thyroid as your fertility thermostat. Even if the temperature is a little bit off, your embryo just doesn't want to move in. Important tests to look at will be TSH, free T4, free T3, thyroglobulin antibodies, and thyroid peroxidase antibodies. Antibodies matter even when your thyroid levels are normal. Number 4, iron and oxygen delivery markers. Implantation and early pregnancy are high oxygen demand states. And even though low iron may not show up as fatigue, it will always show up as either weak ovulation, thin lining, or early loss. Because you can't grow a baby without oxygen. And iron is how oxygen gets delivered. Important tests to include here would be things like ferritin, serum iron, and transferrin saturation. Hemoglobin alone is not enough. Number 5, vitamin and mineral status, your fertility builders. Micronutrients affect egg quality, hormone receptor sensitivity, and embryo development. And although deficiencies will not necessarily stop cycles, they will definitely lower the quality. Think about it like building a house but using really cheap materials. Everything looks fine until it collapses on top of you under stress. Good tests to include here would be things like your vitamin D levels, your vitamin B12, folate, either serum or RBC, magnesium, preferably RBC magnesium, but get whatever you can, and zinc. These affect egg quality as well as hormone signaling, not just energy. Number 6, inflammation and immune markers. Implantation requires controlled inflammation, immune tolerance, and vascular remodeling. Too much or too little immune activity will actually prevent implantation, even if the embryos are perfect. Because pregnancy requires your immune system to invite, not attack. Great tests to include here would be things like HSCRP, ANA if there is a history of immune involvement, fasting insulin, and hemoglobin A1C, because metabolic inflammation counts as immune stress. If you've been told his tests are fine, listen closely. Number 1, semen analysis. Beyond just count. Sperm contribute to half the DNA, placental development, and miscarriage risk. We care about how sperm move, interact, and survive, not just how many exist. Because it's not about how many sperm show up, it's about how many are actually capable of finishing the job. Important parameters to look for would be your sperm concentration, motility, morphology, and total motile sperm counts. And you need to remember that even a normal report can still hide functional issues. Which brings us to section number 2. Sperm DNA integrity. Even normal sperm counts can hide DNA damage, and this impacts fertilization, embryo development, and miscarriage risks. This becomes even more important with increased age, stress, toxin exposure, or past illness. Even though the sperm may look fine on the outside, the instruction manual inside is damaged. The test you want to run for this is something called sperm DNA fragmentation, either SCSA, tunnel, or comet. Each of these tests look at DNA integrity, but in slightly different ways. You absolutely do not need to run all three of them, but to choose which one is right for you, I think it'll be great to consult with a knowledgeable healthcare provider. And running a DNA fragmentation test is especially important with increased age, stress, illness, or if you're suffering from repeat losses. Number 3, hormonal signaling in men. Yes, because men have hormones too, and hormonal signals influence sperm production, sperm maturation, libido, and timing. Low or imbalanced signaling affects quality long before sperm counts drop. Because sperm don't grow themselves, they need instructions too. Tests to include here would be things like total testosterone, free testosterone, SHBG, which is sex hormone binding globulin, LH, and FSH. Number 4, nutrient status and oxidative stress. Sperm are extremely sensitive to oxidative damage and nutrient deficiencies. This directly impacts DNA quality, motility, and embryo health. Think of sperm like fresh berries. They spoil fast if the environment is not right. Great tests to get for this are things like vitamin D, ferritin, zinc, and markers of oxidative stress, if those are available. Most couples come to me saying the same 4 things. All my labs were normal. The doctor said to wait a bit longer. He doesn't need to get testing yet, and we'll test later if it doesn't work. And the issue isn't that any of these are actually wrong, but fertility usually does not fail loudly. It fails quietly, and by the time you did all that waiting, you would have lost valuable time. Fertility is time-sensitive biology. It's not a waiting game. Testing is not about labels. It's about answering 3 basic questions. Are signals being sent correctly? Are the egg and sperm responding well? And is the environment safe for implantation? Miss 1 and conception stalls. If you're trying to get pregnant and want more clarity instead of guesswork, follow and subscribe for more bite-sized fertility clarity, one step at a time.